What some may say is a masterful review of glucosamine chondroitin in regard to osteoarthritis, in the very least, and they call it a systematic review, but still, this is real comprehensive. We are looking at identifying 2,607 studies, of which 2,013 were actually reviewed. Of that 2,013, they wanted the high quality studies, in which case 96% of them were, and on top of that, 59.6, so we should say about 60%, were deemed randomized controlled trials, part of that gold standard. Before we begin too much, let's get right into the research as follows. The safety and efficacy of glucosamine and or chondroitin in humans, a systematic review. Let's look at chart number 1, which kind of brings it all home. 90% effectiveness rate, and of course 10% not. But again, you look at the p-value, 0.05, so give and take, you get the picture. All right, 75% favorable safety rate. Again, too, people could be allergic to shellfish, other things along those lines. So you have to take that into account, even though, once again, there are glucosamines now which are vegan. How credible? As we pointed out prior, 2,607 of those identified, 2,013 reviewed, 146 actually used, 96% high quality, 59.6% randomized control, and 34 years over a period of time these studies were conducted. That's a mouthful. All right, let's get right into the abstract as follows. And to reiterate, 2013 is not the year, that's the number of studies reviewed. 146 studies were identified in our review, with nearly 60% being randomized controlled trials, and most conducted in Europe, Asia, and the US. Even the US was third. Most studies focused on osteoarthritis and joint pain, with over 90% efficacy studies reporting positive outcomes, and most safety studies indicating minimal or no adverse effects. Glucosamine and chondroitin were most commonly administered together in doses of 1,500 milligrams to 1,200 milligrams respectively. Forgive me if I speak fast. We have a lot of territory to cover, which we'll come back to in a second. So we'll come back to the important parts. Respectively and often compared to placebo or Celebrex. Conclusions. Overall, the evidence suggests that glucosamine and chondroitin are generally effective and well tolerated, particularly for managing osteoarthritis and joint pain. Consistent dosing strategies and favorable safety profiles across a diverse range of studies support their continued use in clinical practice, but further research is needed related to other diseases, especially, for example, temporomandibular dysfunction, TMD, joint dysfunction, a real positive outcome there, and also, too, as far as a signal and association of the consumption of glucosamine in the reduction of the likelihood of dementia. We'll cover that in a second. All right, let's look at number 2 as far as the type of studies utilized. All right, that rheumatoid arthritis one, there's only 3 studies. Of those 3 studies identified, there was no efficacy in regard to rheumatoid arthritis. So again, further research is needed to be conducted to confirm or deny its efficacy as either nil or something. All right, and also too, we want to look at dosages most frequently used, 1,500 milligrams, 1,200 milligrams, combination, glucosamine and chondroitin, most often studied. And of course, here's an important part. When glucosamine and chondroitin first came out, either independently or together, most people were under the assumption of 8 weeks before any beneficial outcomes were observed. But since then, we're now looking at close to 6 months. So for those in clinical practice, 6 months is more of a realistic expectation in regard to noticing any sort of benefit or efficacy in regard to glucosamine and or chondroitin or both. All right, let's go back to the study as follows. All right, we can either read through this or for simplicity, we could look at this chart. All right, this is how, with our current knowledge, we identify how they complement each other. I'll leave that up for a second for you to notice. Each one does something a little different, but there you have glucosamine and chondroitin. That's why when you connect them together, they seem to be synergistic in their impact. All right, now let's go to the highlights, the things that are quite interesting. Signal 1, they call them associations, I call them signals. All right. Additionally, many studies also found that glucosamine and chondroitin prevented or reduced the rate of cartilage breakdown, reduced joint space narrowing, reduced markers of cartilage breakdown, and improved maximal mouth opening in temporal mandibular joint disorder, which is quite interesting. All right, these objective findings combined with improved subjective findings on patient satisfaction and quality of life in many studies demonstrate that glucosamine chondroitin can provide many advantages for joint conditions. And there's really not much to show, but here's your chart in regard to the efficacy rate in reference to the 7 studies conducted on TMD, temporal mandibular joint dysfunction. And so far, really good. All right, signal number 2, or association. Interestingly, cell protective effects were also reported as glucosamine chondroitin was associated with a decreased risk of dementia in 2 different studies. That could be confounding, like healthy user effects, so on and so forth, but still just the same, these are the breadcrumbs. Now from there, researchers need to grab and basically elucidate those findings. All right, let's go to the conclusion. All right, glucosamine and chondroitin provide beneficial effects on efficacy, particularly in osteoarthritis and joint pain. These effects seemed especially positive when glucosamine and chondroitin was used in combination rather than alone, suggesting these 2 ingredients have a synergistic relationship. Back to the chart I showed you when they work like a puzzle piece that work together, that piece together. You know, puzzles that lock. All right, the benefit of glucosamine chondroitin remain consistent with compared to the inactive control, such as celecoxib. However, further benefit may be seen with other nutraceuticals and nutritional supplements. Especially, they elucidated to type 2 collagen being the most effective thing to combine with these 2. Again, don't want to add publisher bias, but that's a signal. All right. In addition, glucosamine and chondroitin alone and in combination have minimal safety concerns, with the primary side effects being mild gastrointestinal complaints. Our results suggest that oral doses of 1,500 milligrams and 1,200 milligrams of glucosamine and chondroitin, respectively, in 2 or 3 divided doses, well, I ended like an incomplete sentence. Further studies are needed to determine optimal dosing based on other patient-specific factors. So 1,500 milligrams or 1,200 milligrams before I butchered that entire sentence in possible 2 or 3 divided doses. All right, last chart synopsis with references. What we're looking at here, positive effects. Again, this is the temporal mandibular joint dysfunction. Turned out to be real positive. Cauchy-Beck disease, is that how you pronounce it? It's an adolescent form of osteoarthritis. Really positive signal in reference to that. Also, 2, not found effective in rheumatoid arthritis in the 3 studies reviewed, but also concurrent use of acetaminophen may lead to a smaller therapeutic effect from the supplements itself. So that's kind of a weird thing, but otherwise, there's your reference numbers. There, when you look at the full study itself, if you should, but otherwise, still just the same. Wow, that was long and a lot of speaking. Gratitude to the researchers. That is amazing. A masterful view. 2,607 identified, 2013 looked at. 96% of the 146 they finally chose were considered high quality. Of those, 59.6% were randomized controlled double-blind placebo studies, part of the gold standard. So there you have a real positive confidence level in the therapeutic potential of glucosamine and chondroitin. And again, gratitude to the researchers. I am humbled you watch. Look forward to see what you and I discover next week. Again, catch you all next time. Bye.